I think our bus is unique in just about every way it operates. To work on it is very unique, to come out to it is really unique. The service is so different and special. And I say that from my perspective working on it, but I hear it from every child that comes on here. I don't really like clinics or doctors and nurses, but I sure like this place. I'll come back here. And that tells you you're doing something really special.
When you come onto the Alex bus, especially for the first time, they like to introduce themselves and everybody that's on the bus so that you know who's gonna be around you, and they introduce what they're doing and the confidentiality and like how they work, and they just start explaining everything to you so you feel more comfortable.
We go to 7 different schools and we see each school 1 day a week. Sometimes we'll go to different schools 2 days a week if the need is there. We always keep the same schedule. Our bus is an important resource to the young people that we see, because a lot of them don't have any access to the medical system and they don't feel that they can be a part of the medical system. We try to be really comforting in a calm setting, a safe place for them to get a gateway into the medical system. We look after them in a sort of a 360 kind of way where they get their medical needs met, they get their social needs met, their emotional needs, all sorts of things that we can do for them here.
The bus has been a really good resource for me, like very important in my life, because the first school that I was going to for high school, I was reaching into a lot of medical problems, kind of self-inflicted, but they happened and I needed some help. And the friend of mine that introduced me to the Alex bus told me that, you know, you need help, you need to go see somebody, and if you're not going to go to the doctor, your doctor, then you should come to the Alex bus with me and you should check it out. At least come check it out, look at it, meet the people. If you don't like it, you don't have to go. But if you like it, it might actually help you with what's going on. And so I came and I got introduced to Lyndon and everyone that was working on the bus at the time, and it felt like a good environment, and I just kept coming.
I think I enjoy it because you're being able to give direct service to people and directly help them in a really measurable, sort of tangible way, in a way that they haven't been able to get help before. So you always get to see their eyes get big when they come in, and you take a kid who doesn't trust the medical system and maybe doesn't know their way around and isn't feeling well and has lots of worries in their life. It makes them comfortable and happy, and they get to feel safe and get the care they need. But they would have never had that chance if we didn't drive up to their door and find them, and if they didn't have the ability to find us, because there's just so many barriers for them.
They set such a good aura and such a happy environment so that when you come here, it's not uptight and you don't feel uncomfortable, you don't feel nervous. They kind of break those walls of being in a regular doctor's office down, just so that when you come here, it's kind of like a big family in my world.